You're now listening to the Lunch and Learn with Dr. Barry. This is episode number 5.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to this episode of the Lunch and Learn with Dr. Barry. Today's episode, we're going to be talking about why quickies are better in the morning. But really, most importantly, we're going to be talking about testosterone. And it's something I know you guys probably see on TV on a daily basis, whether you have high testosterone, low testosterone. And I'm going to kind of go and discuss the basics of what testosterone is. I'm going to explain what are the signs and symptoms if you're running low on testosterone. I'm going to explain some of the benefits of having, testosterone replacement, but also, most importantly, what are some of the side effects if you have too much replacement. So sit tight and let's explore the world of testosterone. So today we're talking about, why quickies are better in the morning, right? So first of all, let me answer that question right off the bat, right? Like, why are quickies better in the morning for us? For men have higher testosterone levels like in the morning. Like for when I'm having patients and they're complaining of some symptoms, and we'll talk about these symptoms in a minute, that are concerning for low testosterone, the first thing I do when I order these tests is I make them check it in the morning. So the first thing they do is I make them check it in the morning, because we know in the morning when you first wake up is the highest peak level of your testosterone, because we know at the end of the day it gets worse, right? And if especially for men and even women who have partners and understand that their partner's sexual drive is much higher in the mornings when they first wake up than it is at nighttime after the end of the day. Of course, they blame it on work and all of the things, but a lot of times it really just happens to be with the fact that your testosterone level just isn't what it is in the morning. Like that same person, if you catch them in the morning, it's a whole different story. But at nighttime, as day goes on and work and all these things get piled on, and then just from natural, even if you do absolutely nothing that day, it's gonna be lower at nighttime than it is in the morning. So that's the answer right there, right? Just to get that answer out the bat. So today we're talking about low testosterone. Why am I talking about low testosterone? Because it's something that I see quite often. In a primary care setting, you see it on TV all the time. Pretty much, these the Viagras and Cialises of the world are pretty much based on the fact that sexual dysfunction and impotence is a huge factor here everywhere, but especially here in the United States, where they can make a hell of a lot of money from it, right? So let's talk about testosterone. So testosterone, we'll give you some facts. Required for male sexual development, helps build muscle mass, helps build sex drive, and it in your early adulthood between 20, I probably say 18 to 28 is your peak, right? The peak of your sexual drive happens during that age, and as we get older, in fact, about starting the age of 30. After the age 30, your hormone levels decrease every single year. Again, without you being sick, without you doing anything, your hormone levels kind of decrease. So that's why we tend to see more and more of our elderly patients usually have to take those types of medications, the Cialises of the world, because as they get older, our testosterone levels, which are used to be normal, are on the low side, right? And to the point where it causes a lot of symptoms and problems, and we'll talk about those symptoms right now. So the driving factor, especially for this Lunch and Learn, is focusing on low testosterone and why that's such a big deal. And so I have a few symptoms here, right? Change in sleep issues, right? So if you have low testosterone, we have to worry about your sleep pattern, kind of being off, right? That becomes affected with low testosterone, right? Reduce sexual drive, reduce this increased sexual dysfunction in and of itself, right? You have emotional changes, right? Weight gain, decreased strength, right? And the decreased strength is an important one, right? Because I have a lot of patients. I don't have a lot. I have some patients in my office, right, who take testosterone, but because they're like bodybuilders, right? And if you ever like, go to your gym now, and if you ever see like those really, really like bulk cut up guys, who is just like almost like they eat the weights, a lot of times those guys are taking like supplemental testosterone. We'll talk a little bit about why that's either good or bad from that standpoint there. So these are just some of the symptoms that men face. And men will complain in the office, right? So they'll complain that they're having trouble sleeping. They'll complain that they're having trouble, wanting to have sex, right? Sexual drive becomes a factor. Archie, thank you for joining. They'll complain about, not being able to, quote unquote, get it up. They'll complain about just being fatigued and just in general, like it's just like there's just general feel blah. They just don't feel themselves, right? And that happens a lot for your patients with low testosterone or who are complaining of low testosterone like symptoms, right? So that's definitely a concern that we have when they see me in the office, right? Because that's usually some of the first symptoms, right? They have trouble sleeping, right? Trouble sleeping is a big one too. That they usually tend to complain about as well. So these are some of the things that kind of key me into thinking like, wow, I wonder if there's an issue with his testosterone level. So what do we do, right? So what are some general causes for low testosterone? We know obesity is a cause for low testosterone. I already told you about the age factor, right? Something you really can't change. The older we get, the least likely you have low testosterone. There are certain medical diseases, right? Diabetes, hypertension, all of these things play a factor, especially diabetes, play a factor in our body's ability to produce more and more testosterone. Medications. Medication is important for patients who are on chemotherapy medications, for patients who are on pain medications. And by pain, I'm not talking about ibuprofen and Tylenol. I'm talking about like Percocet, Vicodin. Those types of medications have adverse effects on the body's ability to produce more and more testosterone, right? So there's a lot of stuff that smoking has a lot of depressive effects on our body's ability to produce testosterone. So there's a lot of stuff that we do to ourselves that can cause low testosterone to be a problem. But then there's the issues that, if some patients are born with undescended testes, right? Some people are born with hormone abnormalities that just produces very little to no testosterone, right? So this isn't something that, so there's causes that you can attribute to something that we're doing, and there's causes that you can attribute to something that has nothing to do with you from a genetic standpoint, right? So we got a few causes in there, and of course we talked about the illnesses aspect of it, right? So question I always get, well, doc, what can I do, right? So what can I do? So there's certain foods, right? And when I talk about the foods, the big aspect of the foods is that from a nutrient standpoint, because again, we're talking about low testosterone, we're talking about our hormones. A lot of times there's a nutrient deficiency that's causing this progressive loss in testosterone. That's causing this progressive inability to produce more and more testosterone, right? So that's always important for us, kind of moving forward. Certain foods, right? Again, you're very familiar with these foods: tuna, egg yolks, oysters, beans, and what happens is a lot of these foods are very either vitamin D rich type foods, beef as well, some vitamin D in beef, zinc as well has been another macronutrient that we've seen that does very well for patients who have low testosterone therapy as well, and seem to get some added benefit again. But the number one reason why they usually kind of see me, right, because they want to know about replacement therapy, right? They want to know how much they want to get like testosterone supplementation, whether it be through injection, whether it be through like a patch, like almost like a cream, because we have definitely different formulations. And again, that's not, the type isn't really important. The matter is, when do we get it, right? So when is a person right for having replacement therapy, right? So we talked about these symptoms, right? We talked about patient having sexual dysfunction. And again, I got patients as young as 27, right, with low testosterone, right? So this isn't, hey, doc, hey, hey, Papa D, thank you for joining. We talked about low testosterone, right? So we're talking about patients who have sexual issues, have patients who having like emotional issues. Like a lot of my patients, especially my female patients who have low testosterone, sometimes they're anxious, sometimes they're depressed, and a lot of that kind of deals with the fact that sexually they're unfulfilled, or they can't fulfill their partner. So there's a lot of problems that kind of rise into that factor. More than anything else, a lot of times, like, they don't even have to dry right. A lot of times they just, it's just not even there. And so when I go and I send these patients out to do their blood work, first thing I say is, make sure you do it early in the morning, as early as possible, right? Right when you wake up, just go do your blood test. And the reason why we tell them to go do the blood test is because, again, your numbers for your testosterone level should be the highest in the mornings, right? Because I know if I send you to do your blood work, you do it in the morning, and that number in the morning is also low, then you're like, I already know by the end of the day it's like terrible, right? Because again, as the day progresses, even if you do absolutely nothing, your testosterone levels are gonna drop. So if in the morning when it should be at its highest, and from the highest standpoint, it depends on which lab you go to, but the number ranges from about 250 to about 1,000. I like to have most of my patients around like the 600 mark and above, like just for safe keeping, especially in the mornings. So if your numbers are hovering around that 200, 250 early in the morning, I already know that by the time the end of the day comes about, you're pooped, you want nothing to do with sex, and then not only you want nothing to do with sex, you're probably a little bit bitter, you're probably a little bit more angrier, you're probably more fatigued, so sleeping is definitely going to be an issue. So all of these symptoms, right? Like I like to add all of these symptoms first before we start even thinking about, putting our patients on this medication. Why? Because it's not like this medication doesn't come without its risks, right? Some of the issues that we have to always be concerned about, especially when I'm giving a patient testosterone, is enlargement of the actual prostate, right? So I have to worry about prostate enlargement. So when patients who are on testosterone therapy, who are usually getting it from a medical doctor, we usually have to check their prostate hormone as well, because the same medication I give you for your testosterone replacement can also, if you have like an underlying prostate cancer, cause that to rise and cause that to be a problem. So we have to be very mindful of that. And that's one of the issues I have for my bodybuilding patients, is because a lot of times, because like I don't know where it's at, but so I'm in South Florida, so a lot of them will go to, like, there's like, I guess someone who's prescribed it, someone who prescribes is able to prescribe it, and they're giving testosterone levels that are like ridiculous amount, and they're just kind of filling them up with testosterone to the point where, like I say I like to keep them around 600-700. I got patients who walk into my office and their numbers are over like 3,000, right? Just to give you an idea of how much testosterone you're giving, right? So again, when you see these like bulk, again, I'm not gonna, because I don't want no weightlifting people to like be on my comment box or anything. I'm not saying you can't get like super bulk off of just working out and I'm not saying you can't do that. I'm just saying that I'm just because of what I see, I'm looking at you different, right? Like I'm definitely gonna be looking at you a little bit more I wonder this person takes testosterone because I've seen it. And again, we could tangent on the weightlifting folks, because they take some other stuff that I'm like, whoa. Anyways, so so one thing I have to be concerned about when I'm giving a patient testosterone is their testosterone level. Got to keep that in level and in check, because again, I don't want to give them too much. Also, don't want to give them too little. I also have to check to make sure their prostate isn't enlarging, and I usually check the hormones as well. Breast enlargement, especially in men, is a very common symptom of testosterone replacement therapy. Again, a lot of times, especially if they're taking too much, the testosterone level in their body just turns into estrogen, and that gives you the breast enlargement. On the flip side, I have patients who take testosterone therapy, and then they have their testicles will shrink. Why? Because, and just if you think about it, your brain produces the hormone that produces testosterone in the testicles, right? But if I'm giving you your testosterone, that means your testicles don't have it work right. So to stay with my weightlifting analogy, if you don't have to if you don't have to lift any weights because I'm already giving you the supplement that's going to bulk you up, then you're going to be weaker, right? So that's why the testicles shrink, right? So because I'm giving you that hormone that your testicles don't have to do any work for, so they just like would naturally shrink because of it. So testicle shrinkage, sperm count actually drops. So again, which is crazy because you think about it, again, this are patients who we give testosterone therapy because they're having sexual dysfunction issues, they're having trouble conceiving, and then if I give you a medication, if I give you too much of it, I have to run the risk of causing the opposite effect, right? So that's why it's very mindful of when we start patients on testosterone therapy to kind of look at the whole picture, right? And that's why I think sometimes my patients who, when they go to like these bodybuilding places, I think that's where they kind of fall off on, right? Like they don't look at the whole picture of what's going on. They just say, hey, I just need my testosterone level to be high. And when they started, like most of my patients, when they started, especially, they feel better. They notice a difference. They notice some improvement from that. They notice improvement in their energy very quickly. So it's definitely something that you definitely would notice a difference once you're on it. But it just has to be something that we have to be very mindful, especially as a clinician, to make sure that we're doing all we can to do you right from that standpoint there, right? So again, that's the lunch and learn today on low T and why quickies are better in the morning.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, Lunch Learn Pod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.